Hello everyone, today we are going to discuss about the anatomy of ribs. As you know, there are 12 pairs of ribs in our body which forms the ribs cage. Among those 12 pairs of ribs, first 7 pairs are called as true ribs because you can see here those 7 ribs. First to 7th rib, they attach to the sternum directly. They attach to the sternum directly with the costal cartilages. Then 8, 9 and 10 ribs are called as false ribs because they attach to the sternum by attaching to the 7th rib indirectly. Then 11th and 12th rib is called as floating ribs because as you can see here, their anterior ends are free. They are not attached to the sternum. So they are called as floating ribs. Among those 12 pairs of ribs, those ribs can be divided into two types as typical ribs and atypical ribs. Typical rib means they have typical anatomical features. They have normal anatomical features. Atypical rib means though they are differ from the normal typical rib. Then you can easily remember the atypical ribs. Then the rest of the others are typical ribs. Atypical ribs are first one, second one, 10, 11 and 12. Those 5 ribs are considered as atypical ribs and third to ninth ribs are called as typical ribs. First we have a look on the anatomy of typical ribs. Then we can identify the difference between the typical ribs and atypical ribs. In a rib, there is a posterior end, anterior end. There is a upper border and lower border. And also there is outer surface and inner surface. Posterior end, anterior end, upper border, lower border, outer surface and inner surface. In the posterior end, you can see this area is called as the head, then neck, then tubercle. Head, neck and tubercle are in posterior aspect. As you can see here, in the head, there are two facets in a typical rib. There is upper facet and lower facet. This upper facet uh, articulate with the vertebra above. Upper facet articulate with the vertebra above and lower facet articulate with the numerically corresponding vertebra. That means you imagine this is the third rib. This lower facet articulate with the third vertebra. This upper facet articulate with the second vertebra. Then there is a constricted area called as neck. Then there is a tubercle. In the tubercle, there is non-articular part and articular part. That means articular part is smooth, non-articular part is rough. That articular part articulate with the transverse process of the corresponding vertebra. I'll show you in a picture. In this picture, you can see the articulation of the ribs with the vertebra. Here, this is the transverse process of the vertebra articulate with the tubercle of the rib and the upper facet of the head articulate with the vertebra above and lower facet of the rib articulate with the numerically corresponding vertebra. Then in the inferior border of the shaft contain a costal groove. Here you can see a costal groove. It accommodates the neurovascular bundle. This costal groove accommodates the neurovascular bundle. That means intercostal vein, intercostal artery and intercostal nerve. Here you can see the angle of the rib which is lateral to the tubercle. Angle of the rib which is lateral to the tubercle, it is the most weakest part of the rib. Angle is the most weakest part of the rib. Therefore, fractures are possible in this angle. Fractures are possible from the angle level. Then we are going to learn about the atypical ribs. The first atypical rib is first rib. First rib is flattened from above downward. As you can remember, this appearance of the rib is little bit differ from the typical rib appearance. This has upper surface and lower surface instead of the upper border and lower border in a typical rib. First rib is the shortest, broadest, widest and most curved rib in the ribs cage. There is no costal groove in the first rib. On the upper surface, you can see this is the scalene tubercle. Scalene tubercle, it separates subclavian vein from the subclavian artery. At the neck level of the first rib, it crosses several structures from medial to lateral, sympathetic trunk, supreme intercostal vein, superior intercostal artery and the T1 nerve root. Also, first rib gives attachment to serratus anterior and scalenus medius muscles. Scalenus anterior muscle is attached to this scalene tubercle. When we talk about the second rib, it is not much differ from a typical rib, but you can see there is a special area for the attachment of the first digitation of serratus anterior. That means this outer surface, there is a roughened area for this attachment. From this picture, you can see 11th and 12th ribs. In the 11th rib, there is only one facet in the head. There is only one facet. There are no two facets for the articulation with the vertebra. And also this rib is shorter than the others, as well as there is no tubercle. Also there is no subcostal groove. This is the 12th rib. It also has only one articular facet on the head. It is also short and also there is no tubercle. Also there is no subcostal groove in the 12th rib. When we talk about the 10th rib, the difference from a typical rib is they also have only single articular facet on the head. There are some clinical correlations of ribs. You have to remember that rib fractures are not much common among children. They are common among adults because in children they are not ossified. They are highly elastic. Therefore, fractures are not common. Then the angle of the rib is the weakest point in adults. The fractures are more common at the angle of the ribs. Then there is a term called flyal chest. Flyal chest occur when there is multiple rib fractures. Normally in the inspiration our ribs cage move outward and in the expiration our ribs cage move inward. But when there is multiple ribs fracture, those fractured segment uh, those fractured segment moves inward during inspiration instead of moving outward, and moves outward during expiration instead of moving inwards. So this is called as paradoxical respiratory movements or flyal change.